Imagine facing a medical emergency and being stranded on a remote island. That's the reality for residents of the Isles of Scilly. But now, there's a game-changing development. A helicopter lifeline for islanders needing crucial health care on the mainland. For years, island residents have relied on Skybus flights and the Scillonian Ferry to travel to the mainland for medical appointments. However, these options can be weather-dependent, time-consuming, and frankly, quite stressful when dealing with health concerns. Imagine the anxiety of a delayed ferry when you have a critical appointment. Now, the NHS Cornwall and Isles of Scilly Integrated Care Board, ICB, has stepped in, commissioning Penzance Helicopters to transport patients alongside the existing services. This decision follows direct feedback from the islanders themselves, highlighting the need for a faster and more reliable transport option. Susan Bracefield, acting chief executive of the ICB, emphasized that this new service aims to make these essential journeys simpler, more reliable, and less disruptive for patients. It's all about alleviating that extra layer of stress during an already challenging time. So, how will this work in practice? The good news is that the existing central booking office will continue to manage all patient travel arrangements. They'll assess each individual's needs and select the most appropriate transport option, whether it's the Skybus, the ferry, or now, the helicopter. This ensures that the most efficient and comfortable solution is chosen based on the specific circumstances. For example, a patient needing urgent treatment might be prioritized for helicopter transport, while someone with a routine appointment could still opt for the ferry. And this is the part most people miss. It's not just about speed, it's about providing a spectrum of options to suit diverse patient needs. Robert Francis, chairman of the Council of the Isles of Scilly, believes this addition will significantly improve the overall healthcare service for islanders. He anticipates a more robust service and a considerable reduction in worry for those living on the islands. Catherine Fuller, of HealthWatch Isles of Scilly, echoed this sentiment, expressing her delight that the community's voices have been heard. She praised the increased accessibility and reliability of medical services on the mainland, thanking all the services involved in making a reality. But here's where it gets controversial. While most will welcome this new service, some might question the cost-effectiveness of helicopter transport compared to existing options. Is it the best use of NHS resources? Could those funds be better allocated elsewhere within the healthcare system? This is a valid point to consider and raises important questions about balancing accessibility with financial responsibility. What happens when the weather is too bad for helicopters to fly? Does that put extra strain on the other services? Ultimately, this helicopter service represents a significant step forward in improving healthcare access for the residents of the Isles of Scilly. It acknowledges the unique challenges faced by island communities and strives to provide them with the same level of care as those on the mainland. Now, it's your turn. Do you think this initiative is a worthwhile investment in island healthcare? Are there other ways the NHS could improve healthcare access for remote communities? Share your thoughts in the comments below.